Hello, everyone. So nice to see you all connecting today, and I'm really excited to talk to you all about the neurorehabilitation approaches for dystonia care. So, as we get started, like as Martha said, we will have question answers towards the end. So, in order to help you learn more, be more actively engaged, I'll recommend keep noting down any observation you're making or any presentation you're seeing, which you'd like to talk about towards the end. So keep actively like writing, learning, and gathering stuff together, because there'll be like a shift where I'll be speaking, and then towards the end we'll open up for Q&A. A quick intro about myself. I'm a Neuro PT and founder of Beyond Rehab. Beyond Rehab is a digital neuro rehab and wellness clinic. Our specialty is primarily working with movement disorder group like Parkinson's, dystonia, functional neurological disorder, and more. And I'm licensed to work in 5 states, as you see here: California, Washington, and Massachusetts, and more. So let's get started. So a big thank you to all of you who completed the survey. It really helped me look into like what are the challenges, what are the common presentation, and what are the findings everyone's having. So based on the survey, which we ran almost for 3 months from different groups all across US, we noted that there was a there was like a couple different common themes. First of all, there was some concerns regarding the use of Botox. It was everyone had like different response. Few people had like good results and they continued it for a long time. Few people were not comfortable on getting Botox and they wanted to avoid it altogether. As we all know, there's not much education across the group, both in the medical community and also for the general public. So that we need to continue advancing our education piece so we get everyone timely diagnosed and everyone gets the right care in time. Similarly, when it comes to physical therapy, individuals have noted both positive and otherwise experience, and they noted like it's really, really important to work to get the care from the individual who has the specialty and expertise in working with dystonia community in order to have the right results. So this was the common like theme and suggestions from the group. In order to cover it all and make sure everyone gets to learn something from this presentation, I've divided into a couple different components. First, understanding dystonia, like the nature of dystonia, the science behind it, following by what are the neurorehabilitation approaches, how does it work, what does it mean, and how can you look into it, followed by patient's perspective, like just learning from the community, from the dystonia community, understanding and seeing what are the needs, progressing to the case study, and lastly, self-management and stuff. Okay. So the simple thing, then like, the nature of dystonia. So dystonia is referred as the hyperkinetic excessive movement disorder, manifesting as involuntary or sustained muscle contraction. And it's often like repetitive movements, postures, or both. Everyone has different unique presentation, and it can be divided into 5 different groups. So first is more of focal dystonia, and all these presentation, typically we refer it as isolated dystonia. So dystonia is the underlying condition. It's not accompanied by other neurological disorders like Parkinson's or other conditions. So here it's more of isolated dystonia, and it's based on the presentation, the region of the presentation. It can be classified into 5 main categories. So the first is focal dystonia. Focal dystonia is mainly the dystonia. The affected regions include like cervical dystonia, neck dystonia, hand dystonia, foot dystonia, more like runner's dystonia, blepharospasm, and these are like the common ones, followed by the segmental dystonia. It's more one or more than one body part is affected, followed by multifocal. It's wide different areas of the body affected with the dystonia presentation. Hemidystonia is one side of the body is affected, and generalized it's all over. So this is just to know like which region is affected, how can you best classify it in order to communicate it with your team. So now the big picture, like we all have seen and observed, like dystonia is commonly presented as hyperactive movement disorder, overactivity of certain muscle group. So now looking at it, like, why do you get this presentation? What's happening inside the brain? So it's really, really important to look at the neuroscience of it. So based on the studies being done and based on the researchers finding, it's hard to pinpoint, like, the exact causation and how, like, what is like the possible like mechanism or triggers for the dystonia. But understanding, following the dystonia, how do the brain network communicate is important. So it is noted that it's a neural network disorder. What it means, it's not just one part of the area where you which is affected because of the dystonia, but it's affected all across, like mainly how um, the motor pathways, the functional pathways communicate together is disturbed in dystonia. So it's mainly because of the mm, because of the changes and because of the interplay of the multiple brain region, which results in the excessive motor output. And again, this presentation differs from person to person, but the big message to take away from here is, like, it's the entire, like, more of like the cortical and subcortical different parts of the brain, communication and functional pathways is altered. So it's referred more as neural network disorder. So as you saw, like in the previous diagram, it's not just caused by a single locus, right? It's not just caused because of the basal ganglia or thalamus or something of that sort. The scientists have clearly found out that, it's mainly because of the dysfunction of the numerous regions that tend to result in the excessive motor output. And it's also like more because of the impaired regional connectivity or dysfunction of the connectivity within the network hubs, mainly in the regions like sensory motor cortex, cerebellum, basal ganglia. And different types of dystonia have different presentation, different contribution. And it all in all, like the key feature, the cardinal feature we call it, it's like excessive neural activity, which results in loss of inhibition, and in turn, which results in excessive motor output. So that just, if you want to like look, behind, like, what's happening, what's the cause of this motor output, it will just help you to better understand the process, better learn how the brain is reacting, how the brain is working in this scenario. That being said, now moving on to the presentation, right? So there is a wide range of presentation. In general, there's a lot of talk about motor symptoms, more of the muscle contraction, postures, tremors, but it's beyond that. We need to also look at the non-motor symptoms. It ranges right from the sensory changes, pain, fatigue, balance, gait, sleep, vision, um, emotional changes, fear of movement. So there's a wide spectrum of symptoms which can be presented because of the dystonia, and we really need to look at the whole aspect of it. Uh, it just helps you get the right care. It helps you understanding the nature of dystonia, both motor and non-motor, is effective, is essential to help you continue training yourself, focusing on your self management, and improving your confidence in managing your care. So this was the finding from the dystonia survey. Around 50 individuals completed this over 30 months. And here are some key findings. So one of the most commonly reported findings was mobility, followed by pain, activities of daily living, emotional well-being. Those were like the key features which was uh, reported based on the survey. So like, as you all noted, it's like mainly the pain, fatigue, tremors, balance issue, and postural changes. So a little bit more on a few people have noted down, like just like their perspective on what presentation they experience and how it manifests. So pain and physical discomfort is the common one. Um, they experience like More of the involuntary head and neck movements hinder their mobility daily task, followed by structural changes, including nerve compression, nerve issues, which overall impacts their movement. Looking into the activation and activity and functional limitations of this, like fatigue, increased fatigue, difficulty with specific tasks like standing, writing, if it's based on the presentation, difficulty to socially engage, followed by it takes a really like high toll on their emotional well-being, their relationship. Increased medical consultation just disturbs the overall routine, overall well-being. And accessing the specialized care has been a challenge for majority of the people who completed the survey. And also difficulty in finding the right care providers, creating the right team. Those were like the key. And lastly, like understanding the variability, the fluctuating nature of dystonia, and also the uncertainty in both like diagnosis and the treatment strategy. So now, as we looked into like both the motor and the non-motor symptom presentation, so we need to look at the body as a whole, right? Not just the motor output, but we need to look at like what are the changes happening all across. So this diagram will help us look into it. So starting right from the physical limitations, so this will be a good exercise for all of us, to do together. So this way you'll be able to see like what are the primary concerns, what are the primary challenges you face. So look into the physical limitations. So like what are the physical activities you're not able to do right now? Like is it writing, walking, cycling, just doing your normal household chores, like attending Zoom calls, whatever you experience, put it down, followed by the motor changes. So now motor changes is a mix of couple things here. So what's the presentation you see? Do you see excessive movement on one side? Do you see more of pulling on one side? That can be one key findings, followed by what's your understanding, like do you see any kind of tightness, weakness, coordination issue? Then you can put down more of it in the motor changes. Sensory changes, it's hard to like identify at times, but if you see yourself like you are sensitive to touch, sensitive to temperature, pressure, that can be something like more generic. You can write down like if you think like certain type of textures, or just the pressure around the skin, like where you experience the symptoms is different, then something to be noted more in the sensory. Also more into the autonomic function, like in general, like how do you see your nervous system? Do you see more of more of a regulating pattern? Like do you see you have like a good regulation between your hyperactive like system, more like sympathetic and parasympathetic? Just so seeing like how's your emotional well-being, how's your just response to daily stressors, triggers in general. So it's a big domain, but just to quickly screen it out, that's something which you can write there. And the last thing is psychosocial, just your emotional well-being, how you're interacting with your personal lifestyle, with your overall like environment, just like how's your psychosocial well-being. And last is lifestyle. So lifestyle includes your routine, like right from your diet, your fitness, your sleep, how actively you're engaging in the society, interacting with your groups. So this together will give you like the broad understanding of your presentation and will help you identify like which domain is a big concern for you. For few, like lifestyle, autonomic, psychosocial might not be a concern. You might see yourself doing well, but more of the physical and motor changes might be a concern. I'll just take a pause here, so this way you get to like process and write down your findings. So now as you're understanding the symptoms, the presentation, and learning about what are the different ways you can work on managing your symptoms, taking care of your symptoms, we need to look into what's typically every there's a like easily care delivered, but understanding like the differences between the care which you receive, what to seek, what to get. So moving forward, more looking into the rehabilitation standpoint and understanding the role of physical therapist in managing and treating dystonia. So the first thing is it's really really important to seek the care from the individual who has this expertise and training of working with patients with dystonia, because right now we traditional physical therapy is great, but we don't need to you need more of a specific targeted care, meaning where you're focusing more on retraining the brain, neural pathways, enhancing your motor planning, which is altered or changed because of dystonia, looking into the functional mobility, looking at the whole body picture, right? Like you need to understand the components, both the motor, non-motor, and someone who is actively engaging, researching, and learning from the experts in the field that will help you to get the successful outcome. So this is something for you to keep in mind whenever you're working with the physical therapist. You want to ask them these questions, learn from them, and see if that works for you and accordingly proceed. So understanding the neurorehabilitation approaches for dystonia. So there's a wide range of neurorehabilitation approaches which has been researched and shown effective in treating and managing dystonia. So the first is movement practice, training with constraint, where we are focusing. This is more for hand dystonia. You focus more on using the affected limb, affected hand for training. Sensory reorganization, normalization of muscle activity with the use of external techniques, neuromodulation, and compensatory strategies. Starting right from the phases of neurorehabilitation, right? So the first step, think of it, you're building the foundation, right? So in order to have the right foundation, you want to look into priming the nervous system to enhance brain's ability to make better connection and promote neuroplasticity. Neuroplasticity is the way you're going to help the brain to retrain, reconnect, and re-engage. So the first step in the process is focusing on optimizing the nervous system. How do you do it? You're looking at like the healthy lifestyle routine, right? Like starting focusing on how do you enhance your sleep hygiene? How do you better have like emotional health, stress management, pacing? You're not overloading the system. You're making sure you have like more of a balanced routine, which is helping you, and continuing with like your regular fitness regimen, healthy eating, all in all will help you contribute to your neurorehabilitation process. So this can be something to reflect upon. So see where you are when it comes to sleep, exercise, diet, overall stress management, and see what can you do differently, like, one step at a time, and then you can gradually implement those changes in your life. Now, moving forward, like now when it comes to the phases of neurorehabilitation, so these are like the key approaches which has been extensively researched and been shown to very effective in helping individuals retrain the movement, regain the function, and return to higher level. So starting right from sensory motor training, task-specific training, neuroplastic training, and postural. So these are like the list of approaches, and I'll be covering one by one. So the sensory motor training, it's the sensory motor training has been really, really effective in helping brain reorganize the motor out, the sensory input, and process the enhance the sensory input, and also process have like a better motor output. So the concept here is we use feedback, right? Like we use the movement feedback either through the means of like just like the laser light. You have these targeted exercises designed for you based on your based on your level, based on your presentation, and all all we are doing here is we are focusing on how can you use the targets, like more of the external cues, to move and just follow a certain set movements and repeating it and finding how you're doing it. So a quick example here, you see a lady sitting in the chair. So she's asked to like just look at those like circles on the right side and on the left side. So we initially see how the movement looks like, and then gradually creating a pattern, creating a movement training where the individual is asked to move in a certain range and use the target. So they know how far to go and how they are responding. So they do it with the help of the laser light. It's basically flashing the laser light at each sticky note or just the circles plotted around. And there are different variations. So seeing like the motor, like motor control, the motor output accordingly, designing it to fit to address your needs and uniqueness. Followed by the movement practice. Movement practice with repetition is key, is really key. We really need to focus on retraining the normal movements and finding ways on how can we inhibit the involuntary movements. So this is where like we get to bring a lot of creativity. We get to work and problem solve with the individuals together. So here we are exploring wide range of positions, like for instance, someone with writer's cramp, right? Like if they are doing it more in a sitting position, it's really difficult for them to type. They experience more of the curling, more of the tremors in the hand. However, when they change position more to lying down, lying on their stomach, and typing, they have a different response. And this varies from person to person. One question. It varies from person to person. So understanding like what are the different positions where we can find like the same motor patterns to help you get the similar to help you feel successful in doing or performing the activities. So the writer's cramp, there's a wide range of positions, trying those more in sitting, more in lying down, followed by using different textures like foam, water, just sand, and finding ways on how can they continue with their activities of typing, writing, and seeing the response. Similarly, when it comes to cervical dystonia, we do the same series of activities using different positions, environment. For instance, many people find it really helpful to illustrate the normal movements when they are sitting on uneven surfaces, like more like beanbag or even something like swing. They have like a different motor output. When they are lying on their stomach, they have like more of an enhanced movement and mobility. So finding ways, like wide range, just exploring like how the muscles work in different positions and how the cueing works, right? At times, like simple cues like use of a headband makes a big difference. So finding ways on what are the cues, how it works, in which range those works, and based upon that, we design a treatment plan which is really eliciting like the whole motor movements in the within the normal range, and finding ways on how can you repeat it and how can you make it more fun. Because one of the other key component to look at, it needs to be joyful, right? It needs to be fun, it needs to be challenging, variable. So gradually exploring it, fine tuning it, and making it really, really personalized to you. So this way you're able to retrain the normal movements, and it's graded. So it's not that, you'll be able to get this get to the conclusion right on the day itself. So it takes time, and once you get it, once you repeat it, then the next task is we need to challenge it, right? Like if you're able to do it well in kneeling, now we need to see like what's next. So progressing to more different ranges, different activities is essential. Variability is the key for success. Moving forwards, more of the sensory training. So the sensory training involves like use of different stimulations, like right from different textures, use of weighted headbands, weighted neck pillows, stimulation, using different surfaces, more like using like a regular gym ball for stretching your neck, moving around. So there's a wide range of sensory tools which you can use and see how your muscles respond, how's your motor output, and accordingly implement it in your practice is essential. One other key component is graded motor imagery. It's basically one of the treatment which helps you activate the different brain regions and gradually increase your activity. Uh, so it starts right from using the motor imagery principles where you're discriminating between the left and right. So you can either use like flashcards. You can just identify which side of the, like if you're focusing more on uh, if you're focusing more on your like neck, then you want to discriminate between which side of the neck you're looking. So it can be done digitally through the app, or it can be done using the simple flashcards, followed by explicit motor imagery. It's more like imagining the movement. So imagining yourself, you're actually moving in this direction. You're moving all the way to the right, to the left, looking up. So focusing on the power of imagination and repeating it in different scenario also helps you to activate the different brain region, and which is really essential for enhanced motor outcomes. Followed by the mirror therapy. Mirror therapy is also very effective. So arranging the mirror in a way where you get to see, like, the uninvolved side moving. Like when it comes to hand, it's pretty easy, right? Like you get to just observe the uninvolved side and see the reflection, how your opposite side is moving, and that tends to activate the brain region and helps you improve the motor output. The other way is also, like, nowadays we have started exploring and using more of the virtual reality. If that's something you enjoy, we can look into finding ways on how can we use the VR for training. And as you do it, it's followed by graded exposure to activity. So along with this whole step-by-step process you're engaging, we're also looking into gradually finding ways on how you are uh, performing, how you're engaging in the activity, and gradually, incrementally increasing it and helping you achieve your goals. So, and the last phase is like returning back to higher function, right? Like advancing your skill sets, finding ways on how can you return back to the community exercise, continue with your daily fitness regimen, finding more ways where you're more active, like outside, just continuing with your daily routine is really, really essential. So the last phase of the neurorehabilitation is finding ways and helping you return to a higher level of functions where you're able to keep up with your roles and responsibility and also spend more time and take care of yourself. So all of these phases just helps us prepare you and helps you reach to a higher level where you are able to return to the prior level, see a new you, and see like the whole transformation. And it happens only because of the active engagement, active learning, active and consistent working all throughout the process, right? So it involves different steps, different phases, and it's not like linear. It just, you'll, as you go, you might experience a little up and downs, but just understanding the process and slowly working hand in hand and moving forward is essential. And it's also important to have more of a targeted exercise routine, right? Like any of the exercise routine needs to be aligned with your goals, with your underlying goals. If your goal is to get back to doing a certain activity, we need to keep that in mind and accordingly address it in the treatment plan. And this is like a very effective way on helping individuals succeed and achieve a higher level of function. So like as you saw, right, like all these different phases. So just summarizing the, like the dystonia care program, anytime when you hear like how the rehabilitation piece look like. So the first thing is you need to be ready for this. You need to be ready, and you like ready to engage in the program and ready to commit for this certain hours of work, because repetition is the key, and it's really, really important to see a change. It starts with right from the basics, finding ways on how do we optimize the nervous system, preparing the brain, focusing on standardized assessment, followed by more of subjective objective. And then there are different phases, right? So the first is train the brain. In this, we focus on better understanding your condition, engaging in motor imagery tools, sensory training, motor training. The end goal is finding ways on how do we retrain the normal movements and minimize the excessive motor output movement, or more of involuntary movement. Also looking into treating the underlying factors to addressing the biomechanical changes like posture, nerve tension, strength, flexibility, and lastly, focusing more on skill training. So targeting specific skill training and finding ways on how do we fine tune it, how do we optimize it. So this way you achieve higher level and confidence. So looking at as a whole, so the goal of the dystonia care program is helping you return to the prior level of activities, decreasing involuntary movements, decreasing the overexcitation of the nervous system, enhancing accuracy of sensory processing, improving voluntary controls, and restoring task-specific performance. So this is more the broader and the big goals. So as you learn the whole picture and the rehab, so I'd like to share the case studies, like how did it work for the individuals who engaged, who participated in these programs. So in order to effectively do it, we have divided into 4 phases. So the phase 1 is all about discovery and exploration. Phase 2 is imagine and integrate. 3 is more move and strengthen. You're like more at a higher level. And phase 4 is engage and thrive. And all the other key component is making sure it's done in a time bound frame. So based on the presentation, we make sure we do it more in a targeted and time bounded manner. So one of the individuals, he was diagnosed with cervical dystonia 10 years ago and regularly received Botox every 10 weeks. And his primary concerns was like increased neck pulling on one side, tremor, and pain. So it was limiting his ability to work, engage in social and leisure activities, and it was really limiting his overall day-to-day function and quality. So when he was referred for this program, he engaged, and when we started, like the phase, like the first part of the program was focusing on finding ways on how do we help him get ready, prepare the brain. So as I was saying, focusing on finding ways on how he incorporates mindfulness, simple, healthy lifestyle routine, and gradually engage in movement imagination, more referred to as mental imagery, where he's visualizing normal movement and finding joy while he's performing those movements. So those were like just the initial stages where he was, before he started more into the rigorous piece of the program, he actively performed it. So during the movement exploration and the retraining phase, the key focus was for him was finding new different positions and using different sensory tools like laser light, external cues. So in his case, he was able to see a big change in his movement output while he was like lying on his beanbag. So anytime when he was lying on his beanbag, his movement pattern improved drastically, and that was a really really good good outcome for him. So that helped him, like made him more engaged, more positive about his training plan. He actively engaged and continued his practice, his repetition, and we continued to find ways on how do we challenge it with time. So we explored wide range of positions, and following the exploration, as I said, he started first with just doing normal movements, using the beanbag, using the swing, lying on his stomach, and finding ways on continuing moving the neck along with the headlight, and seeing the good outcome. He reported towards the end of this was like 8 weeks long program, and he had like 16 sessions. So in the initial phase, more like closer to third week, he reported that he was able to attend the Zoom call without use of the sensory cues. So initially, in order for him to take the Zoom call, he used to constantly needed like a sensory cues to align his neck. So he reported, and also he used to adjust his chair to get this alignment. So the first change he saw, he had like a better posture, neck posture while attending the Zoom call. Similarly, he was able to drive without holding his head from the back. So he could use both his hands for driving, and he felt more at ease, more confident in doing it. And also he mentioned that he started engaging more with his kids, like just going for walks, long walks, like engaging with them through play little by little, was the key findings in the during like the initial phase of the program. He continued with his rehabilitation. We progressed, we challenged his neck training in different postures using different uh, environment cues. And as he continued and as he continued seeing the change, seeing the progress, he was gradually able to get to a point like more towards the end of 8 weeks where he was really confident on taking new roles, like more of his roles at work, roles at home, and he saw a big difference, a big shift in his overall neck movement, which helped him improve his confidence and overall quality of life. And it was a gradual progress. So from his standpoint, he reported, like, his like we use the functional scale to rate the presentation during the before the start, during the program, and closer to the end. So he reported a reduction in his scores of key activities like playing with kids, driving, and attending virtual meetings. So these were like his three goals as a part of this program, and he saw like a big change and improvement in all of it. Moving on to the second scenario. So the second scenario was more for for writer's cramp. So the individual was diagnosed almost 6 years ago. She was a part of a program last year, and when she joined, so she reported that she had received Botox treatment with limited success, and her key challenges were typing, writing, and eating. And she really wanted to focus on finding ways on how can she get back to typing more. Right now, she was just typing with one hand, and she wanted to return back to typing more at a fast pace and using both hands, and also writing comfortably. She really enjoyed writing and eating. So when we started, we had a minimal emphasis on the priming the nervous system, as she had a really good lifestyle routine. She had a good fitness regimen, good diet, good sleep cycle, and she was really taking good care of herself. So we were able to jump right to the training phase. And during the training phase, our focus was exploration, like starting finding ways, different position tools for normalizing the movement. So there were different new techniques we discovered which really helped her. Was overhead writing, using different keyboard textures, using the gloves, weighted gloves, using the vibration prior to typing. So those were like the key things, and she had a good set regimen. She was able to repeat like twice a day before she get started with her work and towards the end. And it was really working for her, very easily implemented. And with her progress, with her consistent training and engagement, she was able to uh, continue working on her typing. So initially, we noted that she could type for a good amount of time, almost 20-25 minutes, while she was lying on her stomach or um, lying on her bed, or on the floor while doing this. And gradually we continued changing position, continued finding ways on how can we have the similar output in different positions. So it was a series of exploration, series of training and challenges over the course of 8 weeks. And towards the end, she was able to regain her ability to type and write and she was able to do it at a stretch for 30 minutes without any discomfort. And she reported a 70% decrease in her overall score. So like 70% progress, she was able to get to that level. And following our treatment plan, she continues to have the regular same regimen, understand what are the different components which she needs to include. So she is consistently doing it, and she's seeing the change, and she is seeing a big shift and overall improvement in her quality of life. So as you see, like different approaches and ways we are doing, there's been a lot of research also happening that like dystonia care can be easily delivered virtually. In my practice, I've done all the care delivery virtually for the past 3 years, and I've seen a big success in doing this, because the good thing here is we get to assess your environment, your work environment, your home environment, and see how do you position yourself, what are the positions which really bothers you, what are the instruments you have, what kind of fitness room do you have. So using all the resources, your background, your knowledge of motor training, and implementing all of it together, so it makes unique, really unique and individualized to you, so this way you can repeat it. So repetition is challenging, right? We really need to keep that in mind. So in order to make sure, you are able to successfully do it, we need to understand your environment, understand your background, and do it all. And telerehabilitation makes it very easy because we do it remotely. We get to see all your resources, your environment, and use it as a part of our practice. So the key takeaways, right? Like there was a lot of talking, sharing about neurorehabilitation. So the key takeaway is making sure you're effectively tracking your movement, your output, your assessing, and you're communicating with your care team, right? So making sure you're communicating with whoever you're working and telling them your findings on a regular basis. Similarly, if you are someone who is receiving Botox, making sure you are coupling up with neurorehabilitation. Botox helps the muscles to decrease the overexcitability of the muscles, and combining it with neurorehabilitation is really helpful for the good outcomes, for improved motor function. Mm, and you need to take an active role, right? Like really great job in attending, understanding how it works, and this will help you reflect and find the right resources for you. Uh, so continuously finding ways, repeating regular routine which works for you on a daily basis is important. Lastly, it's important to have more of a comprehensive integrative care approach. So make sure you're building your team, you're working actively with the movement disorder specialist, with the neurorehabilitation, with your general practitioner, and together, with the psychologist, whoever you need, and your care team needs to be, they need to be there, and they all need to stay connected and actively communicate together. So keep that in mind. That's all. Thank you so much for having me here. And just remember, as we all have seen in our lives in different aspects, like neuroplasticity is the brain's amazing capacity to change and heal. With the right tools and guidance, we can rewire our neural pathways and transform our quality of life. So recovery is possible. You really just need to start somewhere. So hopefully just taking one step at a time is a good way to do it. So hope this presentation helps you, prepares you for challenging yourself in a better way, in a more advanced way, and get you to a higher level. Thank you so much. It was a pleasure speaking with you all, and look forward to answering your questions now.